Good afternoon, ladies and gentlemen. My name is Nirav Shah, and I'm the director of the State of Maine Center for Disease Control and Prevention. I'm joined today with Commissioner Laura Fortman, the Commissioner of the Maine Department of Labor. And we're here to provide you the coronavirus update for the state of Maine for today, Thursday, April 30th. And we begin again on an unfortunate note. Maine CDC is reporting the passing of the 53rd individual in the state who's passed away with coronavirus. She was a woman in her 50s from Cumberland County. We have again offer our deepest condolences to the family of this woman, as well as to the families of all Maine residents who have passed away with coronavirus. Every day we go through all the case counts. And while each of these case counts matters, it's also important to remember that every case counts. As some folks in Maine say, every one of these numbers has a name. And I just want to take a moment to make sure we all acknowledge that. With that in mind, Maine CDC is recording now 1,095 cases of coronavirus. That's an increase of 39 cases since yesterday. Overall, 170 individuals have been hospitalized at some point during their illness with coronavirus. That's also an increase of 4 since yesterday. At present, there are 18 individuals who are in intensive care units with coronavirus in Maine and 17 in non-ICU beds. In total, that's 35 individuals, an increase of 3 since yesterday. And 8 of those individuals remain on mechanical ventilators. Overall, 631 Maine residents have recovered, and that's an increase of 16 since yesterday. And of those 1,095 cases, 255 are among healthcare workers. Of the new cases today, of the 39, 20 of them are among outbreaks that are currently ongoing. And we'll talk about those now. I'd like to just go through the numbers of active outbreaks that we're currently focused on, specifically those in long-term care facilities, as well as 2 that I mentioned yesterday. So at the Augusta Center for Health and Rehabilitation, there are a total of 76 cases. At Edgewood, there are 14 cases. At Falmouth by the Sea, a total of 36 cases. At Hope House, which we'll go back to in just a moment, a total of 21 cases. At the Maine Veterans Home in Scarborough, a total of 51 cases. At Tall Pines in Waldo County, 43 cases. At the Cedars in Portland, 15 cases. And at Tyson Foods, which we discussed yesterday, a total now of 10 cases. That's 2 additional cases since yesterday. The team at Maine CDC has continued to be in close contact with the management at Tyson Foods ever since we detected conditions that constitute an outbreak. I've been delighted with the close cooperation and collaboration that we've had by our colleagues at Tyson Foods. Universal testing is being arranged, as is a deep cleaning of the entire facility. Yesterday, we also talked about an outbreak at the Hope House facility in Bangor. Overall, 17 guests and 4 staff affiliated with Hope House have tested positive for coronavirus. All 17 of those cases are new, but please note that I reported on 16 of those 17 cases yesterday. Those 16 cases were not included in yesterday's case count, but all 16 plus 1 more, 17 in total, are reflected in today's numbers. I'd like to provide a quick update on where things stand with respect to our work on public health emergency preparedness. And I'd like to start today's update by providing some additional news on the work that we've been doing to provide for the spiritual care of individuals who themselves are on the front line as healthcare workers. These are men and women who care for our friends and family members across the healthcare spectrum. They care for us, and so we have an obligation to care for them. Now, I often talk about the ways in which we do that in terms of the PPE that we provide them and the other trainings and fit testings that we offer. While we know it's important to protect their bodies, it's also just as important to help protect their minds and their souls. And so for that reason, Maine CDC has been working with social workers and counselors and chaplains across the state to offer that spiritual guidance and that counseling service to any healthcare worker across the state who needs it. We've talked about the Frontline Warm Line a week and a half ago. I'd like to now provide an update today on our spiritual care response team. This team has come together to plan for and organize the in-person or group setting provision of spiritual care to healthcare workers across the state. It's being led and facilitated by Chaplain Lori Hamilton Whittemore, who's taken the lead in facilitating this, along with the Maine CDC individual, Ms. Kathleen Westcott. I'd like to just take a second to thank both of them for thinking about the needs of healthcare workers at this time. Again, although we know it's important to care for the body, it's just as important to care for the mind. And so in that spirit, this spiritual care response team has been working with facilities across the state. For example, at the Tall Pines facility in Waldo County, we've reached out to them and provided behavioral health care resources, as well as offered contact and counseling services to the men and women who are working at Tall Pines as healthcare workers. As another example, at the Maine Veterans Home in Scarborough, we've been working with the social worker at the Maine Vets Home to offer that same spiritual care to staff members in order to help those healthcare workers support their efforts. We're also assisting the Maine Veterans Home with their own planning for a memorial service that will be held this summer to honor all the men and women who have served, as well as those who are residents of the Maine Veterans Home who have been personally affected by COVID-19. I'd also next like to provide an update on the work that we're doing to encourage and provide more healthcare workers with fit testing. Fit testing is a necessary part of being able to utilize one of these N95 masks that everyone's heard so much about. N95 masks are great. They can be critical for healthcare workers. But before a healthcare worker can use an N95 mask, they have to go through a training and a fitment process that ensures a good fit of the mask so that it can actually protect someone from getting the virus. We've been working with our colleagues at the National Guard to conduct more and more fit testing exercises at healthcare facilities across the state. Just in the past 24 hours, the National Guard has fit tested and certified 21 staff at the Tall Pines facility, 6 staff at Biddeford Estates, and 10 staff at the Deborah Lincoln House in Belfast. In total, this is now 37 additional healthcare workers, just in the past 24 hours, who are now certified and able to utilize an N95 mask so they can continue to go on the job, keep providing healthcare, and themselves remain safe. I again would like to thank the men and women of the National Guard for joining up with us to offer this fit testing opportunity for healthcare workers across the state. Maine CDC's Public Health Emergency Preparedness Program is continuing to distribute vital life-saving PPE to emergency and frontline healthcare workers across the state. Today alone, 43 orders will be going out. Approximately 80% of those orders are going to congregate care settings with a focus on nursing homes. About 14% of those orders are going to frontline first responders, EMS, paramedics, and fire and rescue. Just today, Maine CDC, working with our colleagues at the Guard and the Department of Transportation, will be pushing out 18,288 pieces of PPE today alone. And we will continue to do so to ensure that frontline healthcare workers, as well as emergency medical personnel, receive the PPE that they need so they can continue providing healthcare services to all Maine people. One note on our supplies of PPE. We've just received a large order of surgical gloves from Kimberly-Clark. These are the nitrile, the blue gloves that are so vital for healthcare workers. As a result of this significant order that we've just received, Maine CDC now has on hand 1,142,000 gloves. Our supplies were running a bit low, but thanks to this order and the receipt of it, we are now over 1 million gloves on hand that again can be distributed to frontline healthcare workers at hospitals, nursing homes, as well as first responders out in the field. I'd also like to provide a quick update on two other pieces of equipment that have been in short supply nationwide. One are the swabs that are used to conduct the test for coronavirus. These are the swabs that are placed in your nose or back in the back of your throat that healthcare workers use to get some saliva that we use on our test. As many folks might have seen, there's been a difficult time in getting those swabs nationwide, not just in Maine. We've been working on that issue, and I'm pleased to report that beginning on May 4th, Maine CDC will be receiving 15,000 swabs every week on an ongoing basis starting on May 4th. 15,000 swabs per week. Another item that's necessary for testing that has been in short supply is the gel, the media, that is used to transport the swabs to our laboratory or to any laboratory for testing. It's called viral transport media. And there's been a shortage of that because of the incredible increase in demand that we've seen. We too have been working on trying to solve that problem. Similarly, starting on May 4th, Maine CDC each and every week will be receiving 11,200 vials of this viral transport media every week. 11,200 vials each and every week starting on May 4th. Finally, before I turn things over to Commissioner Fortman, just a quick update on the PPE distributions overall. Since we began our work distributing PPE, Maine CDC has now responded to 1,326 requests for PPE. Many of the facilities that have received PPE have received multiple shipments, and we will continue this work with the goal in mind of making sure that healthcare workers and emergency frontline responders during this health emergency have access to the life-saving equipment they need so they can continue to go to work every single day. And I again want to thank the members of our team here at Maine CDC in the Public Health Emergency Preparedness Program for monitoring our supplies of PPE, coordinating the transport and delivery of, and making sure that we were on top of keeping a constant and steady supply of inventory so that healthcare workers across the state can keep going to work every day. Finally, again, before I turn things over to Commissioner Fortman, a quick update on the vital statistics. As of right now, there are 330 total ICU beds across the state, 171 of which are available. There are 313 conventional ventilators, 286 of which are available, and 397 alternative ventilators available across the state. So with that, I'd like to turn things over to Commissioner Fortman before we turn to our colleagues in the media. Commissioner?
Thank you very much, Dr. Shaw. Last week, about 7,400 new individuals filed for unemployment benefits. This is the lowest number of initial claims in the last 6 weeks, but that level remains historically high. Since March 15th, the department has paid over $200 million in benefits to over 70,000 eligible Mainers. These uncertain times have been particularly difficult for our small businesses and self-employed Mainers. I know that for many of you, waiting for unemployment benefits has been a challenge. And that is why the Department of Labor has been working as hard as we can to stand up new programs. Since mid-March, we've taken many actions to streamline the state unemployment insurance program and build in automated, simplified processes as we create entirely new federal programs. We are doing this at the same time as we are responding to unprecedented levels of claims, calls, and questions. To just give you an idea of some of the things that we have been doing, we have modified the unemployment claims system to reflect the state's emergency legislation, which was passed on March 18th. That eliminated the waiting week for claimants. We waived the work search requirement through May 30th, and we ceased charging individual employers' experience ratings for COVID-19 related layoffs. We have also trained staff from other departments, and we want to thank our colleagues from across state government for having their employees come and work with us. And we've also brought back retirees. Additionally, we've trained Career Center staff to do password resets, employer outreach, and help people file their claims online. Some of the staff have also been added to our 800 unemployment insurance phone line. We started an alphabetical call-in schedule on Monday through Wednesdays to decrease the call volume so that the phone line stays stable. We added 100 people from a Maine-based call center to answer the unemployment phone lines, and we've extended those phone hours from our normal 8 to 12:15 to 8 to 3 p.m. We also rolled out the $600 payments under the federal pandemic unemployment compensation program on April 16th. And last week, I talked to you about expediting 20,000 claims that were in pending status to allow many people to move on through the process. And now, I'm pleased to say that we will begin accepting applications for the Pandemic Unemployment Assistance Program. This is the second federal program that we're rolling out, and we begin doing that tomorrow, Friday, May 1st at 8 a.m. Pandemic Unemployment Assistance is a new federal program. It expands eligibility for unemployment benefits to workers not typically covered by unemployment insurance in the past. This includes people who are self-employed, those who do not have enough earnings to qualify for state unemployment insurance, and people who are unable to work as a direct result of the COVID-19 public health emergency. If you are eligible for pandemic unemployment assistance and your claim does not require additional review, you should begin receiving benefits within 7 days from filing your initial claim and your first weekly certification. Normally, unemployment insurance benefits have a 10 to 14-day waiting period, so this 7-day turnaround is a significant change. All claims will be retroactive to the date of the business closure or job separation caused by COVID-19 and the information that you provide on your application. By law, pandemic unemployment assistance benefits start at 50%, that's 50% of the average weekly state unemployment benefit for self-employed and those who do not meet monetary eligibility for state unemployment. In Maine, that amount is $172 a week. In addition, Anyone who receives pandemic unemployment assistance benefits will also receive the $600 additional weekly payment from the federal Pandemic Unemployment Compensation Program. That benefit is available with each weekly claim filed for the weeks ending April 4th through July 25th, 2020. For the self-employed, once we verify your documented earnings, which will take place later in May, pandemic unemployment assistance benefits will be adjusted retroactively if your benefit amount is determined to be higher than that $172. This is consistent with how other states are paying their pandemic unemployment assistance benefits. Pandemic unemployment assistance is retroactive to March 15th, but if you lost work earlier than that due to COVID-19, you will be able to provide documentation to show us the actual date that you were impacted in the near future. Depending on your status, here's what you should do to apply for pandemic unemployment assistance. First, if you have already applied for state unemployment benefits and have been denied due to insufficient earnings, you do not need to reapply for pandemic unemployment assistance. Your claim is in the system and will automatically transfer to pandemic unemployment assistance. You should just continue to file your weekly certification. If, however, you have filed for state unemployment benefits and your claim remains pending, do not file for pandemic unemployment assistance until that claim is resolved. You can only collect pandemic unemployment assistance benefits if you are ineligible for state unemployment benefits. If you are denied for state benefits, we will automatically enroll you in pandemic unemployment assistance. Also, if you are self-employed and were denied state unemployment benefits because self-employed people are not covered by state unemployment insurance, we will automatically enroll you in pandemic unemployment assistance. You will need to file weekly certifications, and if you have any outstanding weekly certifications to be filed, you will be advised to file those certifications. The system will allow you to file for the weeks that are noted on this certification. If you are self-employed and have not filed a claim yet, please visit www.maine.gov/unemployment and fill out the streamlined application for pandemic unemployment assistance. You will also need to submit your weekly certification each week afterward. And finally, if you are not self-employed and have not yet filed an initial claim under any unemployment program, you will need to file a claim by going first to the Reemploy Me website, and if you are determined to be ineligible for state benefits, your claim will automatically be converted to a pandemic unemployment assistance claim. I know it sounds like there are a lot of back and forth, but there is actually only one form that if you have not already applied, you need to fill out, and the work will happen behind the scenes for you. I want to remind everyone that pandemic unemployment assistance requires you to file a certification every week in order to receive benefits. This is the same process as for state unemployment benefits. Our staff has worked very hard to make this process as simple as possible. To that end, I have an important part of the application process to clarify. When we first announced that we would begin accepting applications this Friday, we said if you were self-employed and filing for pandemic unemployment assistance, you would be asked to self-attest to your earnings. After review and to further simplify this program and to ensure benefits are delivered as fast as possible to everyone who is eligible, we have removed that initial step. Instead, if you are self-employed, you will be asked to provide documentation of your earnings after you start receiving your initial benefits. I made this decision to help get money in your pocket faster. Later this month, you will be asked via email to upload your documents, such as tax schedules, to your pandemic unemployment assistance claim. If you have those documents ready now, I'm asking you to please hold on to them and do not send them until we request them. And to be clear, once we verify your earnings, we will ensure that if you are eligible for additional benefits, they will be paid retroactively. I know you have been waiting for this program to get started, and we've been working hard to get it ready. While we are confident that this system will handle claims smoothly, an orderly process will ensure that everyone seeking to file for benefits gets through. We encourage everyone to apply online for pandemic unemployment assistance. And we ask for your cooperation on following an alphabetical schedule for filing once the application period opens at 8 a.m. on Friday. Starting tomorrow, anyone who is potentially eligible under pandemic unemployment assistance who has not already applied and will be automatically enrolled as I described above, you can begin filing an initial claim for these benefits along this schedule. If your last name begins with A through H, file between 8 a.m. and 10 a.m. Last names I through Q, please file between 10 and noon. And last names R through Z from noon until 2 p.m. This does not mean that you have to file during those times. You could file anytime afterward as well. The online application is open 24/7, and filing later in the afternoon or on Saturday will not affect your claim. We just wanted to point out that there is no need to file first thing Friday morning, as you are able to file your claim for the week through 11:59 p.m. on Saturday, and benefits will be the same, and all benefits will be retroactive. Let's work together for a smooth rollout for these new benefits. The 1-800 unemployment phone number will still be available during normal business hours tomorrow from 8 until 3. And on Saturdays, unemployment staff typically work and make outbound calls to claimants. However, this Saturday, since we are rolling out this new program, we will also be taking calls on Saturday from 8 a.m. to noon to answer any questions that you have about pandemic unemployment assistance and to process those pandemic unemployment assistance claims. More information about the program, Pandemic Unemployment Assistance Program, and instructions on how to apply can be found on the Maine Department of Labor's website, www.maine.gov/unemployment/PUA. Processing the past month's surge of claims while also working to stand up completely new federal programs has taken tremendous effort, and I'd like to thank my staff for their incredible hard work and dedication. I also want to thank you for your time and your attention today, and for your understanding as the department has worked nearly around the clock to process claims and set up new programs. These programs will bring new support to many Mainers in this incredibly difficult time. And thank you, Dr. Shaw, for allowing me to be here with you today.
Thanks so much, Commissioner Fortman. Really appreciate it. Thank you very much. We will now turn to our colleagues over in the media. And today's leadoff question goes to Steve Missler over at Maine Public. Steve, go ahead.
Thanks, Dr. Shaw. I appreciate it. I know you've talked a fair amount about antibody testing, but I know that there's some providers, particularly in the southern part of the state, that are starting to offer that testing. And as you know, and I think you've said before, there are some real limitations with what those results actually mean, and that they're not really a certificate of immunity according to WHO, et cetera. Can you just tell me what the utility of these tests are? It's also my understanding that some people that are doing these tests are sending their results to the state to collect, presumably because that data is of some sort of importance or utility to you.
Great. Thanks, Steve. So Steve asks for an update on where things stand with respect to antibody testing. Many of you may have seen that there are healthcare say with some degree of certainty, hey, and we hope that you don't get it again. Steve, where things stand right now is that scientifically, there are still more questions than answers. Although antibodies can be detected, we don't know yet whether the antibodies that are being detected are specific to the coronavirus that's causing COVID-19 or any of the cousins of the coronavirus. We also don't know yet whether, even if you have those antibodies, how long they might stick around in your body for, which is to say, we don't know whether, even if you've got some immunity right now, what it might look like in October or November. So there are more questions right now than answers. One of the things that we're doing right now, Steve, is preparing a communication for healthcare providers across the state to bring them up to speed on antibody testing. We do require that even if an antibody test recognizing those limitations, even if a provider does run an antibody test and it comes back positive, providers are still required to report that to us. And Steve, just to go into the weeds for a second, that is one of the ways in which someone could go into this probable case definition category that I talked about a week ago, and that's consistent with the national guidelines around this. We can get you more information on that. But providers still have an obligation to furnish Maine CDC with those results. But the interpretation of those results and the clinical utility, right now there's just not enough science to know what it means. We still recommend that if someone is concerned about coronavirus, they've got symptoms, they get the regular test that our laboratory and other laboratories across the state are offering, because we have a much stronger sense of how to interpret that and where to go from there. Thanks, Steve.
The probable cases, do you have a number of what those are and how many of those were the result of antibody tests? And then I'll let you go.
Yep, you bet. No problem at all. So as of right now, today, Steve, there are, of the 1,095 cases in Maine, 31 of them are in the probable case definition. I don't have the exact number that are the result of antibody. We'll get that for you. I believe it to be a very small number. I think probably in the single digits. Usually the vast majority of folks in that probable case definition are close contacts, household members of confirmed cases who develop symptoms, and then that's how we classify them as probable, not so much through the antibody route. But we recognize that antibody testing is being done, and we want to be able to do something with those results, and that's why we've included them as part of the probable definition. Thanks a lot, Steve. You bet. We'll turn next to TJ Tremble over at ABC 7.
Yeah, that probably is about.
Good afternoon, Dr. Shaw. Thank you. I have two questions, one for yourself and one for Commissioner Portman. And the one I'm asking you may not even be for you. You decide. Well,
Okay,
it's a viewer question, wondering whether starting tomorrow, if people can mingle with people from other households in groups of up to 10, or is that only being allowed with people from their own household?
So TJ asks about, as we take steps toward reopening, at what point can folks mix with, intermingle, socialize with folks from other households. And TJ, you know, I think we're getting into this territory where the answers are not yet quite well known. So what I would recommend is that you stick with those groups, those small groups, but recognize that doing so should come with some tight guardrails. If any of the folks in those small groups are elderly or have pre-existing health conditions or are immunocompromised, they should continue to stay inside and limit their exposure. To the extent that anyone does, you know, one of the things that's become popular, at least in our neighborhood, is everyone throwing their chairs on the driveway and intermingling, but keeping 20 or 30 feet apart. That's still probably a best practice. We're still at the stage in which these even small group interminglings entail risk. And that's an unfortunate reality. Even a small group of folks getting together from different households is a risk. And so where possible, or it can be done at a long distance, that's still the best strategy going forward.
Thank you, sir. Commissioner Fortman, you mentioned simplification and automation in the process. What other steps have you taken to avert the system crash that happened when the initial benefit unemployment claims happened earlier, a few weeks back?
So TJ is asking, what steps are we taking to avert system crash, which took place several weeks ago when we began accepting claims. Actually, TJ, our system never did crash. What happened was it was the phone lines that crashed, but the actual online application has withstood all of the hits that have been taken. But the phone line, yes, did crash. We had a day where we received 250,000 phone calls, and that took down the phone system for the entire state government. And since then, we moved to an alphabetized system for the phone lines, but the online 24-hour-a-day re-employ me system has functioned throughout this, and we anticipate that it will continue to do so.
Thank you. And Dr. Shaw, can I just ask one more question?
Yeah, sure. Go ahead, TJ.
What we're going through now, how does that compare with what you expected several weeks ago?
So TJ asks about how does today compare with what we expected a couple weeks ago? And TJ, you know, a couple weeks ago, at these very meetings, we were talking about how to allocate ventilators. And my colleagues and I across the country were talking on our nightly phone calls about what algorithms we might use and the inhumanity of even contemplating how we might have to decide who would get the last ventilator in our state. We're not there today. So in that respect, things are certainly looking better than they did just a few weeks ago. But we're still in the middle of things. And TJ, you know, I think the best analogy that I've heard about this is that many months ago, our boat capsized. We made our way to the life raft. We're paddling to shore, but a ways off in the distance. I'm going to turn next to Dr. Don Kerrigan from News Center.
Thank you very much, Dr. Shaw. I have a question, maybe a follow-up for you, and then a separate, unrelated question to Commissioner Fortman. The first question, Dr. Shaw, for you is the CDC investigating a case in Waldo County involving a firefighter who passed away and potential contact with several other area fire departments? Can you tell us anything about that?
Yep. Thanks for that question, Don. We are aware of that situation, and an investigation is underway. Because of the personal privacy involved and the various personal details, I can't comment on it any further, partly for privacy reasons, also because our investigation is just underway. But we are aware of that unfortunate situation, And our team of epidemiologists and disease detectives is starting the process of looking into it.
Okay. Then I have a question for you about the reopening, and then a question for Commissioner Fortman. With the reopening starting tomorrow for a variety of businesses, some of them, including dental clinics, are apparently short of PPE, in part because maybe they gave it away to other healthcare workers. And some of your other businesses allowed to open, hair salons, places like that, are required to wear masks, but not cloth masks. And are they able to get this material? Is there any guidance being provided to them to how to get this? And if dental clinics need N95, do they, and can they get that?
So Don asks about the scope of for whom Maine CDC offers and provides PPE. And Don, I'll respond in two forms. The first is that the focus of our efforts to push PPE out are, as I've outlined here today, and which is to really focus on frontline healthcare providers in high-risk settings, such as nursing homes or EMS workers. For any business that is taking steps toward reopening, I think making sure that they can secure a supply of PPE on their own as separate and distinct from the emergency supplies that are sent out by our public health emergency management team for emergency frontline workers. I think those entities that are making steps toward reopening, part of their calculus in determining how and when to reopen should necessarily involve making sure they can secure a line of PPE so that we can preserve our supplies for frontline healthcare workers in nursing homes and places like that are struggling to get the high volume they need. And then I'll turn things over to Commissioner Fortman. Yep.
Yes, and Commissioner Fortman, this may be a very simple, brief question for you. If a person who's receiving benefits, if their business reopens, but the worker is still afraid to go back to work because they believe there's a risk, or at least a fear, of contracting the virus there, can they still get benefits, or if their business reopens, are their benefits ended?
So it would be nice if it was a straightforward question, Don. So Don's question is, if a business reopens and the employer reaches out to workers who are receiving benefits, must they return even if they are afraid of the risk of COVID-19 infection? And the answer is, it depends. There is nothing in any, either the state unemployment insurance program or the federal program that allows people to refuse suitable work. So if your employer is calling you back, the expectation is that you will come back. However, if you have, there are a number of conditions that permit you to not go back to work if you are to quarantine, and if you are have an immune to you, those are laid out. So this is one of those cases where we would, or if your employer is offering you a telework option, we would have a fact finding to try to understand the circumstances and to make a determination. But so again, it depends. And we have additional information up on our website. There's a checklist there that lays out the conditions where it may be acceptable to not go back to work. But the underlying premise is that if someone is offered suitable work, the expectation is that they would take it, and there were some of these.
Thank you.
We will turn now to Kara DeRose over at the Maine Beacon. Go ahead, Kara. Kara, over at the Beacon, your line's open.
Oh, sorry. My question is for you, Dr. Shaw, and it's in regards to the Mason plant in Portland. I'm wondering if there's any plan to pause or idle work at the plant, and if you could confirm if workers would be fully compensated during that period, and do we know what health care benefits are being provided to workers at this time?
So Kara asks about some of the specifics around the plan that that Tyson Foods is in connection. Kara, I have some general. I think general bottom line is that I would refer most of those questions to Tyson. We have discussed idling the plant, and I know that there is a plan in place on Tyson's front. But in order so that I don't give you inaccurate or incorrect information, I would refer you to Tyson for the specifics. Again, I do know that they have agreed with Maine CDC's recommendation to idle the plant, to do a deep cleaning, to conduct universal testing. But for the specifics and nuances, they would be able to give you much more accurate information. Commissioner, I don't know if you wanted to tackle the question about unemployment without your call on that one.
Well, I would hate to give specific information about particular companies, but in general, if an employer had to close their business and was not paying anyone their wages or vacation time or any sort of paid leave, and the workers were furloughed without pay, they would be eligible for unemployment insurance benefits.
And I'll just say on top of that, Kara, in recognition of that concern, so we always have a concern in mass testing, particularly in environments such as this, meat processing, poultry processing. We always want to make sure that we're testing everybody. That's the goal of the mission. And if employees are concerned about not getting wages, there's a risk they may not show up or they may refuse testing out of that concern. Recognizing that concern, Kara, I actually personally spoke with Commissioner Fortman so that I at least had a baseline understanding of how these things worked. And Commissioner Fortman personally offered to connect with staff at Tyson so that they had an open line of communication. So we were aware of that concern and the potential public health implication, and that's why Commissioner Fortman and I personally connected around this yesterday. We're going to turn next to Patrick Whittle over at the AP.
Hey, how do you do?
Good, Patrick. What's going on?
So, you mentioned, I believe it was 15,000 swab tests per week coming up starting May 4th. A company in Guilford, Puritan Medical Products, is boosting swab production, which we all know are needed to ramp up testing. I'm curious if these swabs are necessarily going to come from that facility, and also if you could talk about some of the different dates that are coming up, if you have the ability to address how the May 1 phase-in and the May 31st stay-at-home order, how those don't conflict with each other, I think that would be helpful.
Great. So Patrick's first question is around the swabs and the origin, the manufacturer of those. Patrick, we've had a long-standing relationship with Puritan. We've spoken with them multiple times through the course of this outbreak. We've received swabs from Puritan separately. I am not sure whether any of the or are from Puritan. We'll try to find out. They're part of a larger order, and so it could be from a multiple set of manufacturers, a conglomerate of different groups. So I'm not sure whether or how many of any of these 15,000 is from Puritan, if any at all. We'll try to find that out and get a little better visibility into that for you. But rest assured, we have ordered from Puritan, and early on in this outbreak, we connected with each other, and they've been a great partner of ours. Even as many other places in the country were finding it challenging, Puritan was always able to help out Maine CDC in our laboratory in order to keep a steady supply of swabs coming. This 15,000 per week is just in addition to all of that, but we'll get you more information. As to the latter question, Patrick, we'll note that question. I'm actually going to refer that over to Commissioner Johnson's team over at DECD to make sure we get you the most accurate information. So our communications team will notate that question, Patrick, and get you an answer.
Okay, swell.
You bet. Thank you. Next up is Amy Brown over at WERU. Go ahead, Amy.
Thank you, Dr. Shaw. With the outbreak at Tyson, which is something that's a pattern across the country now, and concerns earlier about Bath Iron Works, wondering if there's any whistleblower hotline that employees can use if they feel that safe practices are not being followed in their workplace. And then I have a follow-up question.
Commissioner Foreman?
So I would just, so the question from Amy is there any sort of a whistleblower hotline to address issues of safety concerns on the part of employees? And those in private sector environments, it's the OSHA, the Office of Safety and Health Administration. And we have some information about that up on our website. OSHA, of course, is a federal agency. People could call our office as well at the Maine Department of Labor, and we would refer those calls to OSHA.
And are whistleblowers protected if they make a complaint like that?
I wouldn't want to guarantee that, but typically there are whistleblower protections. But again, anytime a case goes, I think that investigations can be done without necessarily identifying individuals. But since this is a federal program, I would not want to comment on that. But let's follow up, and I can get you additional information.
Okay, thank you. And Dr. Shah, I know you said that there are not clinical trials, that none of the hospitals in Maine are participating in any of the bigger clinical trials, but do you know if remdesivir is being used in the state, maybe just on its own without being part of a trial?
Yep. Actually, Amy, I believe that one of the hospitals in the state is actually participating in one of the trials around remdesivir. I don't know which trial specifically, whether it was the, remdesivir, okay, yeah, not one that interprets easily. I don't know whether the hospital in Maine that is participating was part of the results that Dr. Fauci at the NIH previewed yesterday, or whether it is a separate trial. In general, however, I am aware that at least one hospital is. Also, in general, Amy, Maine CDC, we don't get notified when any provider decides to use any drug in any particular manner. That really is a decision that is between the physician and his or her patient, and to the extent that the pharmaceutical company might need to be involved for compassionate use purposes, they would be. But Maine CDC doesn't stand between any doctor and any patient.
So it can be used now without being part of a trial, if they choose to do so?
It can be, provided it's done so in accordance with U.S. FDA guidelines. Maine CDC doesn't have any guidelines around that, nor would we. That really is a matter between a physician, the Board of Licensure, and the Federal Food and Drug Administration.
Thank you.
You bet. We'll go now to Jessica Piper over at the BDN. Go ahead, Jessica.
Hi, Dr. Shaw. I have one question for each of you, but I'll start with you. The data that the Maine CDC released today suggests that there are racial disparities in coronavirus cases, with Black and African American Mainers seemingly more likely to have a confirmed case of the virus. I was wondering if you could speak at all about why that might be, and if that factors into the planning that you're offering.
Question, Jessica. Jessica asks about some data that we've recently released around deeply concerning racial disparities around coronavirus across the state. Those data and that pattern has unfortunately been mirrored in a number of states across the country where those same disturbing racial inequities have been observed. There are a few potential reasons for why this could be the case. One is that we know that racial and ethnic minorities unfortunately have jobs that put them more in the path of the virus. Every single day, someone who's a racial or ethnic minority is more likely to be in a job that is consumer-facing, frontward-facing, that puts them in that direct path in a way that non-minorities may have the ability to work from home and be quarantined. That's one reason. Another reason is racial and ethnic minorities, not just in Maine, but across the country. The third, and one of the things that we're trying to make sure that we remedy, is to make sure that specific to new Mainer populations, they have access to primary care and are able to be tested. In connection with that, Jessica, I've made sure to have direct meetings via Zoom with representatives of the new Mainers communities to educate them and brief them on the coronavirus situation, try to work with them to remove roadblocks to access for care for the members of their communities, and provide materials for those members of the communities to make sure they've got everything that they need, such that if they're not feeling well, they know where to get care, they know where to get tested, and they know where to go for follow-up. Those disparities are concerning. They were alarming to us. We wanted to make sure we published the data as quickly as we could, and we're trying to take steps now to correct as many of those inequities as we can.
Thank you, Dr. Shaw. And then Commissioner Fortman, I was wondering if you had an estimate of the number of workers who will be automatically enrolled in the Pandemic Unemployment Assistance Program, as well as how many new applications you expect to receive this weekend, and how is your department prepared to handle another surge in applicants?
Sure. Thank you, Jessica. So the question is, do we have any idea about the number of people who will be automatically enrolled? And then also, do we know how many will be applying for the new Pandemic Unemployment Assistance Program? And finally, how is the department preparing for that? So in terms of the automatic enrollment, I think that one of the easiest numbers would be the 7,000 people who were denied last week. Jessica, that was one of the streamlining benefits, is those folks were denied. It's clear that they're eligible, and they will roll into the Pandemic Unemployment Assistance Program. Some of the people who are in a pending state may also be eligible for pandemic unemployment assistance, and we'll be working on that behind the scenes. People could be applying as of tomorrow. We don't collect that kind of data. Our data is really with people who are traditional employees, so people who receive W-2s. Those are the folks we work with, the roughly 45,000 employers who employ them and pay into the Unemployment Insurance Trust Fund. This new pandemic is pulling in people who are not connected to us typically. We have worked with our colleagues at Maine Revenue Service to get an estimate of how many people potentially are eligible. And we believe that's somewhere in the 70,000 person range. We don't know how many of those folks were impacted by COVID-19, because that is a piece of the criteria, is that you must have been impacted by COVID-19. That is the other reason that we are encouraging people to apply online and to go through that process. That is available 24 hours a day, 7 days a week. We have conducted 4 Zoom sessions over the last 2 days to reach out to organizations, employers, as well as individuals, to walk through the process so that hopefully people are better prepared for filling out the application. We also have the 100 recently hired claims specialists who will be answering the phone, so the phone will be available to folks. We again encourage people to use that as a last resort, not the first place to go, and to use our website to get information, to carefully fill out the application. One of the things that we discovered from the last surge in applications was because people are anxious, and when they go to fill out the application, especially if they're not used to working on a computer, that they may hit incorrect numbers in there. So please just, take your time, gather the information you need, which is basic. It's your social security number, it's your name, your address. We encourage people to use direct deposit, so gather your bank information and take your time going through that. Also, to make sure that we reduce internet traffic, we're asking people to voluntarily comply with 2-hour segments tomorrow as the program gets up and running. So again, it's an A through H from 8 to 10, then from 10 until noon. It is I through Q, and then R through Z from noon until 2. Again, there's nothing that requires you to follow that schedule, but we think that by spacing that out, people will not have as much internet traffic and be more successful. We're also going to have hours on Saturday as well. We always have been working Saturdays throughout this whole process, but usually we use that time to make outbound calls, to call people who have left messages for us. This Saturday we will also be taking incoming calls from 8 until noon. So those are the steps that we're taking.
Thank you. We will turn now to Megan over at WMTW. Go ahead, Megan.
Thank you, Dr. Shaw. Thank you for taking my question. This is a question for you. We've talked a little bit about where you see where we are now in terms of the virus and the outbreak and spread. Well, yesterday we talked about Hope House, that was Docket, and Tyson Foods also as two new areas where you've identified outbreaks that the CDC is investigating. So, you know, kind of at first glance, it would seem that we've had some decent increases in confirmed cases over the past few days and 2 more outbreaks that we've added to the list. Is this concerning to you as we are on the eve of reopening some businesses tomorrow? That certainly means a lot more people will be out and about.
So Megan asks about some of the more recent outbreaks that we've reported on just in the past day. And Megan, those 2 new outbreaks are concerning. They are concerning. They come on the heels of other outbreaks that we've been reporting on at long-term care facilities across the state. And every single new outbreak presents new challenges as well as raises concerns. But I would also contextualize those outbreaks in the following manner. The first is that outbreaks just don't come to us. There's not a red phone on our wall that rings and someone says you've got an outbreak on your hands. We actually go looking for outbreaks. Because of our policy to engage in and recommend universal testing, outbreaks aren't told to us. We are out there discovering them because we are looking for them. So it's a deliberative fact-finding process that we're undertaking by design. We'd rather know about something like that happening and be able to mitigate it rather than not know it's happening, even though it might make our numbers look different. So our posture here is very deliberate. We want to know, and we actively go forth and find the outbreaks. But they are concerning. Our goal when we identify these outbreaks is to try to cordon them off. In my own head, Megan, I think about it as, you know those balloons that they use to make balloon animals? And the artists who do those things, they take the long balloon and they twist it in certain ways and contain the oxygen or the air that's in each segment of the balloon so it doesn't travel back and forth. That's how I think of what we're doing with these outbreaks. We're out there looking for them, and then when we find them, we twist the balloon a little bit so that it stays contained. That's our goal, at least. And that's why we take such aggressive measures to test everybody, to try to limit visitation at nursing homes, and all of the other steps that we've put into place. Now, we recognize that doing so is challenging. In fact, I can attest with my own family, restrictions on visitation in healthcare facilities are downright disruptive. But they do help us twist that balloon so that when you put pressure on that system, it doesn't spread over to another part. That's our goal. We are concerned about these, but please also recognize that in context, we're deliberately out there looking for these so that we can get a handle on them so as few people are as affected. Thanks for that question, Megan. We will turn next to Kevin Miller over at the Press Herald.
Hi, thanks, Dr. Shaw. A quick question first and then a second. We're still seeing some confusion or hearing some confusion from dentists about what's going to happen tomorrow, at least as of this morning. Can you clarify for us, are dentists going to be able to offer routine care, or is this still only emergency care?
Kevin, I'm going to make sure we get clarification for you, certainly from our colleagues over at DECD. The bottom line there is that in order for any healthcare provider, or in this case, hair salons and other stylists to open, one of the things that we are requesting is that before they open, they make sure that they can do so safely. And that in those situations, it does entail making sure that they've got a clear and steady supply of PPE. We'll get you exact clarification on those parameters around, say, dental practices. I'll have Robert work with you to make sure you get that information clearly. But our big concern from a public health perspective is that as they move toward opening up, they have that secured supply of PPE so that they can open up not just to offer services, but also in a safe manner.
Okay.
Yep.
Thanks. And then follow up on, I think you and I had talked last week just about or maybe it was earlier this week, kind of lose track, the R value for Maine.
Mm-hmm.
Now that we're kind of on the verge of opening up the state, where do we stand now? You said we were approaching 1 the other day. Are we at 1? Has it gone up or down? And kind of how has that changed over the past week or two?
So Kevin asks about this number that epidemiologists use and that we've talked about during these meetings, the R number. It's the number of cases that are spread after a single person has a case. And our goal in any outbreak is to get that number below 1. Kevin, we actually just reran the numbers, and we're going to get you some more data on where things stand. But we are quickly approaching 1. And that's a good sign. It doesn't mean that we are out of the woods by any stretch, because I think as we've all talked about, that number can go back up as quickly as it can go back down. But Kevin, we've actually rerun the analysis as we do from time to time using the latest data that we've got. And the models are, of course, models. They are not predictive as so much as they are for planning, but they also help us get a sense of where things stand. And so we've rerun those. We are approaching 1. We're still not below 1, which still means that each case generates more than 1 subsequent case. So we've still got a ways to go. We are still in the thick of things. And we'll get you more of that analysis, Kevin, really soon, probably later this afternoon, once the giant supercomputer is done running it.
Great, thank you.
You bet. I'm going to turn next to Kate Koff over at the Ellsworth American. Go ahead, Kate.
Thank you, Dr. Shah. I will ask my 2 questions in succession since the first one is pretty succinct. The first one is, can you give us a ballpark figure for what hospitals are charging to treat a patient who's hospitalized due to coronavirus? And the second question is, I'm hoping you can clarify something for me. So the executive order that describes that 14-day quarantine period for travelers, it says, I'm going to quote, that travelers must immediately self-quarantine for 14 days or for the balance of 14 days dating from the day of arrival, except when engaging in essential services. So I'm wondering, can you tell me, does that mean that a traveler who comes into the state who's observing the quarantine, does that mean that they can, go grocery shopping and go to the bank and get gas and all of those things? And if that's the case, then can you tell me what is the difference between the stay safer at home directive and the 14-day self-quarantine?
Sure. So let me take those in reverse order. Actually, I'll take the first one, Kate, with respect to hospital charges. I don't have great visibility into that. That is a question that I would probably, to make sure you get the best accurate information, probably ask the hospitals. We might have a little side of things at DHHS, but the overall hospital charges writ large, that's probably something the hospitals would be able to give you more insight into. And so, Kate, your second question is fundamentally about the difference between the stay-at-home order from Governor Mills and the quarantine order. And the quarantine order for out-of-state visitors is really that. It is a quarantine order. It is unless you are to go out to do something that is absolutely essential to live, i.e., go to the grocery store, you are to stay inside. In fact, on top of that, our view is that for any visitor coming into the state, they should be prepared from the moment they arrive not to need to go outside. It is just that, a quarantine order. Governor Mills's order that applied to state residents still allows for folks to go outside if they are taking a walk with a household member, things of that nature. Those activities are not allowed and not contemplated under the 14-day quarantine order for out-of-state visitors. We are going to turn next and finally to Brad Rogers over at WGME.
All right, thanks. A question for each of you. Dr. Shaw, licensed massage therapists like dentists are also asking for clarification. They're on the list of medical professionals who can open Friday, but massages are part of that stage 3 group. Can you clarify that?
So Brad asks about the status of massage providers, massage parlors, as they are currently in stage 3, and how do they land there, and what is the status with them? Similarly, Brad, we'll get you clarification on that. Robert will notate that question, and we'll make sure you get the right answer from our colleagues over at DECD.
Okay.
All right, thanks. Mr. Fortman, how many Mainers right now are getting unemployment, and do you have an idea of how many are still waiting to receive their checks? And also, what unemployment benefits are available for business owners, and if they don't open for some reason, are they still eligible for those benefits?
So Brad's asking a couple of questions. One is how many Mainers are currently receiving unemployment insurance benefits, how many Mainers are still waiting for unemployment insurance benefits, and then what about business owners? And I wasn't sure, are you saying, are they eligible for anything in terms of unemployment insurance benefits? Okay.
Yes, what benefits are they eligible for, and if they don't open, are they still eligible for those benefits?
Sure. So the first question is how many Mainers are currently receiving unemployment insurance benefits? And as of the end of last week, there were a little over 70,000 Mainers who were receiving benefits, and those benefits totaled about $200 million. The question about how many Mainers are still waiting, there were roughly 100,000 Mainers who have submitted an initial claim. That does not mean that they filed their weekly claims. And when we roll out the Pandemic Unemployment Assistance Program tomorrow, many of those people may be covered. We don't know that. I could give you better numbers after the program rolls out. But one of the criteria for being eligible for the federal program is that you must not be eligible for the state program. So there are folks who are in the system right now. We know many people who are self-employed, filed immediately when they were impacted by COVID-19, and there was no mechanism in the state system, in the state unemployment program, to cover them. And I heard loud and clear how frustrating that was for them. The Pandemic Unemployment Assistance Program, which is a brand new federal program, is designed to cover those people who are self-employed. So the business owner may be covered if they're self-employed, and the factor there is, are they receiving any earnings, any wages? If you're receiving wages, then you're not unemployed under either program. But if you are not receiving wages and you are self-employed and have not applied already, please apply for the Pandemic Unemployment Assistance Program. Additionally, I defer to my colleague, Commissioner Johnson, about other programs that small business owners may be eligible for, such as grants and loans.
Great. Thanks, Brad. I'd like to close on a note that is similar to what TJ Tremble raised a little while ago, which is, where are we compared to where we all thought things might have been a few days, even a few weeks, a few months ago? And I'd like to start by thanking every single person in Maine for the shared sacrifice that each and every one of you has undertaken over the past several months. Things have been disrupted, your lives have changed, and the path we go between now and to when your lives may be back to normal may be a long one. It's difficult to predict what the virus will do. What we can control, what we can predict, is our response to it. But that response is a lot more than just some policies at Maine CDC or some PPE that we push out. The response fundamentally is put into place by each and every one of you. Curves don't flatten themselves. Viruses just don't magically disappear on their own. And that's a good sign. It's been a long night, and there are glimmers of sunlight on the horizon. But we did not get here on our own. We didn't get here because of some advisories that Maine CDC put out. We got here because of the shared sacrifice of each and every one of you, trying to make sure you stayed inside, making sure you limited contact with vulnerable individuals, doing all the things that physical distancing we now know can create a benefit for. And so I would just like to thank each and every person watching as we acknowledge the challenges that you have endured. We are on that path. We are paddling toward shore. And I hope we get there in the same way we got to where we are now, which is to say, as a team. Things will continue to improve, but we have to be mindful that things are still in a situation where we are in the middle of. But when we get there, when we get to shore, it will be the same way that we got into this, which is as a team and as a state. These responses don't happen on their own, and they're just simply not a result of policies that we push out. They happen, and we have gotten here because of the shared sacrifice of each and every one of you. And so I thank you so much for that. So with that, thank you all for tuning in today, and we'll talk tomorrow. Thank you.
And that is Maine CDC Director Dr. Nirav Shah wrapping up the daily briefing on COVID-19 alongside Maine's Labor Commissioner Laura Fortman. Lengthy briefing, almost 3 hours and 20 minutes because they had a lot of ground to cover. A couple of highlights. First, from Dr. Shah's perspective, he announced the 53rd death related to COVID-19 in Maine, a woman in her 50s from Cumberland County. He says we now have 1,095 cases. That is up 39 from yesterday. However, he pointed out that number is a little bit large in part because it includes at least 16 cases that were revealed yesterday at Hope House in Bangor, but were not included in yesterday's tally. So that's part of the reason that number seems like it has jumped up more than it usually does. Dr. Shah was asked about what's happening tomorrow, which is May 1st. One of the things that can happen is dental clinics, for example, are being allowed to reopen to do routine care. However, they need to have personal protective equipment to do so. Dr. Shah pointed out that the Maine CDC supplies are reserved for emergency and frontline workers, and that private dental clinics, for example, and hair salons, whoever else wants to reopen, is going to have to secure their own supply of personal protective equipment so they can operate safely. That's something that may take some time, in case you're wondering why your office or your hair salon is not opening right away. He was also asked about the workers who don't go back to, I'm sorry, we'll shift over now to to Laura Fortman, the Labor Commissioner, who talked about how tomorrow morning is when the website and phone lines will open for the Pandemic Unemployment Assistance Program. That begins tomorrow at 8 o'clock. Now, you do not have to get online or make the call right at 8 o'clock. They actually ask that you stagger by alphabet during the morning. And because the website is open 24/7, you can apply anytime into the weekend and not have your chances of getting benefits affected. And those benefits, she says that the benefits should start flowing in a very quick 7-day turnaround, which is faster than usual, and they will be retroactive to when a business closed or a job was lost. Now, these are the benefits for workers who have been denied because they're not typically covered, they're self-employed, their earnings have not been high enough, what have you. You'll also have to submit your earnings documents if you're self-employed, but they ask you not to do that tomorrow. Instead, they want to start the flow of payments immediately then return to that and make sure you're getting the adequate amount that you're entitled to. So they will ask you somewhere down the road in the next few weeks to submit those earnings documents. And she was also asked about workers whose jobs are reopened, but they don't care to go back because they're worried about the risk, the health risk. It depends, she said. It's not really clear. It'll depend on each individual case, but there is nothing in either federal or state unemployment programs that allows you to refuse suitable work, with the exception of some health conditions that would require a quarantine. Now, that was a lot of ground to cover. We're going to break it down for you much more tonight on News Center beginning at 5 o'clock, so I hope we will see you then.